Next up, let's talk about some common diseases associated with your special senses. Okay, first up is the condition blepharitis. Blepharitis. We've seen some of these word parts before in this unit, but the first thing I'm going to want to do is for you to break down the term. This is one of those diseases where if you understand the medical terminology, you're going to quite clearly understand what's happening to your patient. Okay, so take a moment, see if you can break down the term blepharitis, and then we'll do it together. Okay, so in the term blepharitis, there is no prefix. The root term here is blepharo, which referred to the eyelid, which is what we were picturing on the previous slide. The suffix is itis, which refers to inflammation. And so the term blepharitis is officially defined as inflammation of the eyelid. Okay, so what we're seeing here is blepharitis. So this patient's eyelid is all nice and inflamed. You may also see some redness, some pus, some discharge. There are no shortage of reasons as to why this can happen. Everything from allergies to an infection, something structural that's going on with the eyelid itself. But blepharitis is that generic term for when that eyelid has become inflamed. Okay, next up we have the disease cataracts. Okay, so this one doesn't break down quite so easily, so we're not going to really do a word breakdown for this per se. However, this is a dog's eye. I just thought it was a slightly better picture in being able to visualize what I'm going to talk about here. But what happens with a cataract is that you can see the center of this poor dog's eye, this pupil portion, right, that should be nice and black, has become almost cloudy or gray. And so what's happening is that the lens, or that portion just behind, okay, the eye, starts to get a bunch of deposits on it, and it does not allow your patient to see clearly. Now, I know I'm showing a dog's eye here. This also happens in humans, just our pupils a little bit smaller, so this was a little bit easier to see. But when you start to cloud over that lens, right, the patient will not be able to see clearly. Everything they're seeing becomes clouded. But if you're looking at their pupil also looks clouded. Let's talk about one disease of the ear, and this is otosclerosis. Okay, otosclerosis. This one, you can break down the word and really understand what's going on. And so let's first, for this one, do a word breakdown. Okay, so for the term otosclerosis, again, if you need to hit pause, okay, for a moment, break it down yourself. We'll talk about what it is. All right, so the term otosclerosis does not have a prefix. There are actually two root terms, oto and sclero. So the term oto refers to the ear, and sclero means a hardening. The suffix here is osis, which means a disease condition of. So the term otosclerosis means a disease condition where the bones start to harden inside the ear. So let's go back to our picture of the ear. Okay, so again, here we see our diagram of the ear. And in that middle ear, just beyond the eardrum, we do have three bones. Okay, these bones need to move just like any other bones in the body. There's partially what's responsible for our ability to have hearing and to sense hearing. Just like any other part of the body, you can get a little bit of almost arthritis inside these bones. So otosclerosis, or hardening of those bones in the middle ear, just beyond that eardrum, okay, is going to impact your ability to hear sounds. And this does tend to happen as people get older, particularly if you have not taken care of your ears throughout your life. So you're listening to loud noises, right? Had any damage to the eardrum or those bones themselves, can cause some otosclerosis. Next up is vertigo. So vertigo is really a disease of the inner ear. Okay, so that labyrinth portion of the ear. And what happens with vertigo is that you start to feel dizzy, right? So have you ever had a moment where, you stood up too fast and you feel like everything is spinning? Okay, that is vertigo. Sometimes it is just momentary, right, from a quick position change. Some people suffer from this quite frequently. But what's happening inside that labyrinth is things are not detecting properly, and so you get this overwhelming sense of dizziness. Sometimes you feel nauseous, right, as a side effect of that dizziness.